So we are in our 14th chapter of this book, which means that we're almost finished with medical ethics. So let's take a look at the future trends in healthcare. And basically, we learned about do no harm in previous chapters, but as you can see up here, medical errors are absolutely significant. And some of the procedures are beyond the reach of the uninsured, and physicians have encountered a need to practice defensive medicine. And studies have demonstrated that excessive medical screening may cause unintended harm. And medical screening is defensive medicine, and it costs a lot more money than just using the doctor's training to diagnose a patient. Patients are constantly being sent out for other procedures. So the next problem that we have is the cost of health care. And some procedures are beyond the reach of the uninsured. And physicians have encountered the need to practice a form of defensive medicine, as I said in the earlier slide, to avoid potential lawsuits. And there's research to show that excessive medical screenings may not be needed and may even cause unintended harm. And this is kind of a repetition of the thought in the do no harm slide. So they all work together. Okay, let's look at the next slide. So the Milliman Medical Index is a standard of measurement for healthcare costs, and it demonstrates that the cost of healthcare has become a greater part of a person's income in the past. And here are some of the issues discussed in this section. And on this slide, we can look at the problems that relate to lack of healthcare providers. And many providers will not accept low-income people because, as you may remember from earlier readings or some of your other classes, if you accept Medicare or Medicaid, in California it's called Medi-Cal patients, then you are not going to be covered unless you're not going to be paid, basically, unless every patient who asks to be seen by you is accepted. So once you say a doctor says yes, then the door is open for anyone of low income. And doctors are getting paid less these days because a lot of them work for hospitals and big businesses, corporations employing doctors, and they just don't get the money that they normally did. So they're struggling with their income, their accounts receivable also. So that's the reason a lot of doctors do not accept Medicare. The germ warfare, the problems basically the Center for Disease Control has developed guidelines for preventing infections in some procedures. Yearly, though, many patients die from hospital-based infections, and they're listing MRSA, and the definition here is a bacterium that is antibiotic resistant, and it causes hard to treat infections in patients. It is absolutely challenging to try to cure a person once MRSA the person has been in contact. And just a little bit more of that, there's so many antibiotics that are not available to treat MRSA, so it's another challenge in the healthcare setting. Fraud is a big thing. There's a lot in the news about fraud, and especially Medicare fraud, where an unscrupulous group of practitioners will get either people's social security numbers and bill them as though even people who are deceased, they'll continue to bill people and try to use the social security numbers or bill for services that were never provided, or upbilling for services that should not have been coded at that high a level. So it's a huge factor. Prescription drug abuse. We probably all read about the problems with prescribing these drugs, and now a lot of doctors are actually afraid to prescribe these drugs because they're going to be under scrutiny. And in some cases, these drugs don't really work. They're not efficacious, but the patient can become addicted to the drugs, and that's another problem. Not just abuse. And then ethnic disparities. Research has shown that all groups of people within a society should expect to receive good health care. However, research studies have determined that certain groups of people do not always receive these benefits, and it is listed here what the problems are. And in our community, of course, we have several Indian healthcare clinics in Tuolumne and Amador and Mariposa and Calaveras County because of this problem. So this is the reason that we have MACT Health Board, to try to deal with people who are underserved and basically abused by medical neglect. Advances in an improvement in healthcare. Prevention is very important in healthcare. Patient rights, hospital patient rights, the right to refuse to be examined, observed, or treated, the right to request another technician to perform a procedure, the right to be moved to another patient room, the right to have an advocate whenever requested, and the right to refuse any treatment, and the right to be made as comfortable as possible. We've talked about robotics, if you've been in my program for a while, in one of my 170 series classes. And this basically is, it can be an exciting aspect of healthcare to have robotics, especially doing surgery, and as you see, smaller applications. So this is an exciting developing area in healthcare. Let's pull this slide up a little bit more. And of course, the surgeons have to be trained to use robotics. And the surgeon is manipulating the robot, but it means that in a small community where a skilled surgeon is not available, and that happens very often, that not the only places that you can get second teams of surgeons to do things that we discussed last week in the case of Margaret and Sarah, is in a large community, and in small communities it's not available. A small community might be lucky to have a general surgeon and a couple of general practitioners and maybe an internist and some x-ray facilities, but as far as having huge teams, they don't anymore. So robotics will allow a surgeon who is highly specialized to operate in an operating room with the assistance of the team that is available and perform a highly sophisticated surgery. So that's pretty exciting pretty exciting advancement in healthcare. The final note in our chapter, I see we don't have a good PowerPoint slide for this one. And as you notice, I've been going through a lot of the slides that are something that you can just read about or view yourself in reading the chapter. But the last point is, how do we teach our patients? And we've had cases on that. How do we teach the patient who was a diabetic, if you remember in one of the earlier chapters? Well, first of all, healthcare professionals must have a good understanding of their topic before they can adequately teach their patients. It's important to offer a clear description of what you are asking the patient to do. They must have an understanding information concerning the new Affordable Care Act, and instructions must be presented in an easy to understand language and, if necessary, in writing. So that's one of the challenges that is being faced in healthcare. So enjoy the chapter, and once you turn in your final, congratulations.